All right. Welcome, everybody. Thank you so much for being here with us this evening. We're really excited to bring to you a message training and learning how to effectively communicate the issues that you care about. Tonight, we are going to be grounding this message training in the healthcare for all legislative agenda. We have 3 top priorities that we're focusing on this legislative session, which starts next week, February 10th. So get excited. But I want to let folks know that we have something that's standing in our way right now that is an urgent issue that we need to speak about and raise awareness on, and that is the personal income tax. For folks that don't know, they have proposed to eliminate the personal income tax, which would unfortunately have devastating effects on working West Virginians, because as we know, the personal income tax funds very critical programming in our state. And so for purposes of our healthcare agenda, this is a concern for us because last legislative session, we had some incredible victories, one being the expansion of dental coverage under Medicaid to allow for $1,000 of preventative care. And that is just one example of something that is potentially at risk if the personal income tax is eliminated. The personal income tax funds a lot of public programs in our state and makes up a big significant portion of our budget. And so we are asking folks that have a self-interest in protecting public programming, public education, to contact your legislators to talk about this issue with friends and family, and letting folks know that we must protect our personal income tax. So without further ado, I would like to welcome you all to tonight's message training. We have a lovely group of folks that are going to be facilitating this training with an organization known as For West Virginia's Future. And they'll be introducing themselves here shortly. But first, I'd like to welcome our Healthcare for All coordinators. These folks have been working tirelessly over the last years to educate and raise awareness and connect with West Virginians all across the state to learn about what issues they're most concerned with as it relates to healthcare, and doing everything we can to fight for affordable, accessible, and quality care for all. If you're able to mute yourself, that would be great. Thank you so much. And without further ado, I'm going to introduce Miss Lisa Doyle Parsons with the Circles campaign and our Healthcare for All coordinator in Wood County. Welcome, Lisa.
Hi, hi, Alex, and thank you. And it's a thrill to be here tonight to share with you about a very important issue, and that is the New Choice Health Program. So I have a little PowerPoint here to share with you. And let's get that started. So what I am sharing about is the New Choice Health Insurance Program. And what that is leveraging our Medicaid infrastructure to increase choice and affordability in purchasing health coverage and address the Medicaid cliff effect for West Virginians. New Choice allows people to use their own dollars to purchase quality coverage that fits their budget. The goals of the New Choice program are to expand health coverage to more people, to create a more affordable coverage option, to simplify the healthcare system for patients, and to maximize federal dollars wherever possible. Despite great gains in getting people insured since the Affordable Care Act was passed, there are still many who are falling between the coverage cracks. They make too much money to qualify for Medicaid, but too little to afford the marketplace policies. One example of this is a mother from West Virginia, a grandmother, who shared that she's on Medicare, but her children, grandchildren, great-grandchildren cannot afford insurance. Most work jobs that do not provide insurance. Some have health issues, but they make too much money to get Medicaid. With the cost of living, they live paycheck to paycheck. Another, our former healthcare coordinator here in Wood County, Amber, stated that currently my family does not have health insurance as we cannot afford private insurance. We make too much money for Medicaid, but we are too young for Medicare. With my health issues, I cannot afford doctor's visits or my medications at this time, and sadly, it's not the first time this has happened. Why do we need the new choice coverage program? Because there's this ugly little big thing called the cliff effect. And at this point, I want to share with you a video to explain what the cliff effects are. If you are not familiar with that, sometimes it's referred to as the benefit cliff as well. So the cliff effect is something that is not only acknowledged nationally by policymakers, but here locally in West Virginia. The West Virginia DHHR Deputy Secretary Jeremiah Samples at a joint committee on children and families in November of 2017 stated what happens in terms of DHHR services there are disincentives. We recognize that there are disincentives we recognize that keep people from getting employment. People think twice about taking a raise at work when the additional pay would put their benefits at risk. These are not folks who don't want to be in the workforce or don't want to improve their station. The system is structured in a way that impedes it. If a household has an increase in income, it can place them above the eligibility requirements. This change in income can prevent people from seeking improved wages in order to keep their level of benefits. And I have to say, I myself can certainly understand this impact. I work at the Circles campaign of the Mid-Ohio Valley, an agency that works with families who are in poverty, working very hard to get out of generational poverty. And I have seen this mirrored over and over and over again. Once our families get working, become employed, and then maybe get that quarter raise, then they lose a $600 child care subsidy, or they lose housing benefits, or they lose their Medicaid insurance. My own daughter, Randy, who has volunteered since she was 13 years old, and then became a Presidential Volunteer Award recipient at AmeriCorps Vista, and is now working at Starbucks. And she herself is unable to take a full-time position because she is afraid it'll put her over that cliff where she cannot keep her Medicaid benefits. So I see this mirrored out in others' lives and even in my own life. So what it looks like is if an individual works 40 hours a week for an entire year, and that means an entire year, 52 weeks, at minimum wage, which is $8.75 in West Virginia, they will gross $18,200 a year. This will make them ineligible for Medicaid, but unable to afford insurance on the marketplace once they factor in their living expenses, such as rent, food, insurance, car insurance, house insurance, etc. So I feel it is really critical that we stop this insanity. We need to support working families and support the New Choice program. So at this point, I want to go ahead and hand things over to Hunter Starks, who's the Kanawha County Healthcare for All Coordinator.
Hey everybody. Sorry while I kind of go between tabs and find myself here. So good evening everyone, and I apologize for reading. Thanks to everyone for joining us, and thank you for our presenters, Ray and Renee, for sharing their expertise with us. I'm personally really thankful for this opportunity to learn how to effectively communicate what matters to me with people who might not have these same concerns on their radar. Like Lisa said, I'm Hunter Starks. I'm the Kanawha County Coordinator for the Healthcare for All West Virginia campaign. And I'm just going to take a couple minutes to explain to you one of the pieces of policy that's really important to me and important to everyone involved in our campaign. So this piece of policy would be life-changing, not just for parents of new babies in West Virginia, but for all of us. Sorry. So I'm here to talk about postpartum care and expanding healthcare access for postpartum people. So the first year of a new baby's life is a critical time of development, and it's not just the health of the baby that we need to worry about, but the health of the mother or birth parent as well. Because for a baby to be taken care of and healthy, their mom or birth parent needs to be healthy as well. With the policy that we're fighting for in the upcoming 2021 legislative session, a postpartum person up to 300% of federal poverty guidelines would qualify for Medicaid up to 1 year after giving birth to their child. So for some perspective on what that means, 300%, a mother in a family of four earning $78,000 a year would qualify for Medicaid under this expansion. So lots of West Virginians would benefit from this expansion. I mean, the median household income in West Virginia in 2018 was $44,097. So most of us would qualify for this coverage for this brief but critical window of time. And so thanks to expansions in this coverage made in 2018, postpartum parents up to 300% of federal poverty levels qualify for Medicaid for just 60 days, but that really isn't enough to cover the critical care that parents need. So aside from just like the regular healing process after giving birth or after having a C-section, we all know new moms aren't back to their pregnancy selves in just 60 days. Like they don't, I have a daughter, and you're not suddenly hormonally balanced and great after 60 days. And according to the American Psychological Association, 1 in 7 people will experience postpartum depression post-birth of their child. These individuals desperately need access to quality and affordable healthcare, not just for their own sake, but for the sake of their baby. And unfortunately, West Virginians too often avoid going to the doctor because they cannot afford the cost, and that leaves them without care that they need. And with this expansion to postpartum Medicaid coverage, it doesn't have to be like that. My dog's saying hi. So through this expansion, parents could get the support and care that they need. And through this expansion of postpartum Medicaid coverage, we could begin to address racial disparities in our healthcare system. While the United States is the only industrialized nation with a maternal mortality rate that is on the rise, we also experience stark racial disparities in maternal mortality. Black women are 3 to 4 times more likely to die from a pregnancy-related complication than non-Hispanic white women. Access to healthcare is critical to changing this reality. And even more, besides supporting healing new mothers and providing support for those experiencing postpartum depression and addressing racial disparities in postpartum health, there's another important side of this policy, and that is parents in recovery. Expanding Medicaid for postpartum people would make recovery accessible for people with addictions who find themselves pregnant. As it turns out, structured recovery programs aren't free and they aren't cheap. They're often just inaccessible to those without health insurance. And I, for one, believe that anyone who's ready to take that step and get sober ought to have options to help them face that challenge. And I mean, when a new life is involved, I think it makes it all more pertinent and important. Recovery certainly doesn't happen overnight, and taking care of a newborn is incredibly stressful. So expanding Medicaid for postpartum people would provide that extra support that folks need to stay sober and therefore stay present and safe in their new baby's life. This policy could really make the difference between a family staying together or not. So this policy is estimated to cost less than $1 million to the state per year, and it would do a lot to heal our state and help us raise healthier families and a healthier community altogether. With this policy, we could address racial disparities, support families, and save lives. And I say it's past time to stop allowing our parents to struggle postpartum. It's crucial that we support families and therefore support our growing communities through this expansion in Medicaid coverage. Thank you all for taking time out of your day to learn both about the policies that we care about and how to effectively talk to folks about the policies that are important to you. And I hope you're able to take what you learned today and use it for the fight for the change you want to see in West Virginia. And I hope you'll consider joining us in our fight. Now I am going to pass it over to Dr. Adam Starks to talk about outrageous prescription drug costs.
All right. Thank you, Hunter. And thank each one of you for being here. Good evening. My name is Adam Starks. I'm the Healthcare for All Coordinator for Barber County. And prescription drugs have, well, they're out of control. And I don't think that's a secret. In 1960, the cost was $90 per capita. Today, it is over $1,000, all right, per capita, closer to $1,100. So we know rent, student loans, mortgages, everything is going up exponentially, but wages have not. And people are rationing the care that they get, whether it's insulin or the outrageous cost of EpiPens or other life-saving measures that are accessible cost-wise in terms of production, but they're not accessible in terms once they're retailed to us. All right, so all of that advertising and everything that we're paying for is costing lives. However, what I'm going to do right now is a little bit different. I'm actually going to bring in an expert, someone who is on the front lines, advocating for patients day in and day out. Her name is Emily Starks. She is a family nurse practitioner at Broadus Hospital here in Philippi, West Virginia.
Hello, thanks for letting me join you. I literally just got home from work, and I'm Adam's wife. That's the part that he neglected to tell you guys is I'm Adam's wife. And I am a family nurse practitioner. I do rehab and acute care patients in the hospital. I also have a specialized wound care clinic. And so that's one of the areas where I really see prescription drug costs be a major issue. And this is my soapbox. This morning, he asked me for just my perspective on it, and he got way more than he bargained for. So he said, hey, can you just talk and tell these people what you know as a frontline provider? And so one of the biggest things that I deal with on a daily basis is affordability equals compliance. A lot of our patients don't want to be non-compliant, but when you can't pay for your meds, when you can't afford your insulin, when you cannot afford your blood pressure medicine, then you're not going to take it. If you have to choose between food and medicine, you're going to choose your food because that's life, and you don't see the impact on a consistent basis, daily, every day about how bad you feel by not taking your medicine. And so that's a major impact into my patient's health. And then what everybody needs to understand, and anybody who's talking to legislators, this is like a really important point that the Nurses Association is bringing up, but more people saying it, the better. Inability to afford medicine equals increase in emergency room visits because they have a catastrophic or acute change in their health. That equals an increased potential for admissions, which ultimately leads to an increase in healthcare costs. So if you want to save money, then the thing to do is make it so people can get their medicines. That's just the bottom line. If they can get their medicines, then they can afford to be healthy and stay out of the hospital, which would ultimately lower healthcare costs. To go along with that, two of the things that I have to deal with, number one, people who have changed their healthcare provider, change their insurance company because of either a job change, a loss of a job, or even like Medicare is really bad for this. So one month, this is the least expensive thing, and the next month something else is, and they'll change what they cover, which makes it my job to either fight for that patient to get coverage or fight to figure out what new medicine they need to be prescribed in order to get them compliant and get them so that they can afford their meds. This causes a lot of med changes and inconsistency, which makes it harder for a patient to be able to do what they need to do to take care of themselves. And the other big issue is prior authorization for medicine. So if I've got a patient who's been consistent on their meds, they've done really great for a long time, and all of a sudden what their insurance will cover changes, I have to fight for a prior authorization to say, no, they need to stay on this medicine because it works. And then that can negatively impact care if I can't get that in time. Particularly in wound care, this is a problem when I'm looking at antibiotics and I'm saying this is what they need based on what they've tried, what their wound culture is telling me they need to be on. And, in a particular instance, like a wound, that's the delay of care, a delay of antibiotics can lead to a loss of life or limb. So it's a big deal. So this is just, my personal experience because doctors spend a lot of time with prior authorizations. I spend a ton of time just doing paperwork, trying to get my patients what they need. And not everybody takes as much time as I am fortunate to be able to take and fight. And because, we have a minimum number of patients we're supposed to see and everything to make money for the healthcare system at the end of the day. But insurance coverage for what medications a patient can get would dramatically impact and reduce costs in every area of healthcare. I firmly believe that. This is, of course, just my perspective, but I've been a nurse for 20 years and a nurse practitioner for the last 2 of those years. And I do a lot of prescription type of things. So my perspective, but I fight hard for my patients. I hope all providers do. And I hope that you take this information and are able to make things better for our patients. Thank you.
All right. Okay, so there you have it. Emily Starks, family nurse practitioner, and my wife. Neglected to mention that before just because it's irrelevant to this point. So, and with that in mind, let's turn it back over to Alex and get this party started.
Thanks, Adam. And thanks, Emily. Thank you so much for presenting, sharing your stories and personal experience. I just want to give a huge shout out to this team, Adam and Lisa Doyle Parsons, Lisa Deal, Hunter Starks, Kim Jones, Jude Stevens. These folks have been working really hard. And I want to thank also Eve Markham Atkinson, our communications coordinator, to really educate and bring awareness to these critical issues. And I know that each of you on this call have issues that are probably important to you and your families, and definitely want to do everything we can to make sure that West Virginians are thriving, right? And not just surviving. And what stands between victory on these issues, as I've mentioned before, is the personal income tax. Right now, the elimination of the personal income tax is at stake, and we are fighting right now to communicate with our legislators and neighbors and friends the importance of protecting the personal income tax. And just to share a little bit about why we would like to protect the personal income tax. If the pandemic's taught us anything, it's that our health is extremely important, especially the services that provide, critical programming for healthcare and education. And West Virginia's personal income tax is our fairest tax, and it's ensuring that wealthier taxpayers pay their fair share. I think that makes sense. So the way that the personal income tax is structured here in West Virginia, the more that you make in income, the more you'll pay in taxes. The less that you make in income, the less you'll pay in taxes. So regressive tax cuts, like eliminating the personal income tax, reduce or eliminate very, very critical programs and raise other taxes on low and middle income families through other means, through sales taxes and other things. So West Virginia has tried to cut taxes in an effort to spur economic growth before, and the state cut $425 million annually from the budget via tax cuts, with little to nothing to show for it. So keep in mind that was something that was done from 2007 to 2015. So what we're saying here is we need to be investing in higher education, public health departments, and other public programs. The personal income tax is something that will do just that. So encourage you to connect with your legislators, family, friends, to talk about this issue. I know that taxes can be like a really daunting subject. Took me a little while to like wrap my head around it, but with the personal income tax, this needs to be protected. If we eliminate it, half of our budget we're going to have to find money to fill half of our budget here in the state. So it's critical, and I encourage folks to do what they can to reach out to your representatives, senators, House of Delegates. As I mentioned before, our legislative session starts on February 10th. So if you can call them now, get in their ear, leave a message, write them a handwritten letter if you're feeling it. We want to get into their hearts and minds before session starts. So thank you so much for letting me speak. I'll get off my soapbox now. We have a really great training prepared for you this evening. Our partners at For West Virginia's Future have been working diligently to help us craft message training based on some research and polling that's been done in our state over the last couple years. And I will let Renee and Ray dive more into that, but I'd like to introduce Renee Haggerty with For West Virginia's Future. She is the executive director. And thanks so much for being with us, Renee.
Thanks for having me, Alex. Is this coming through all right for everybody?
Yes.
Sounds like it. All right. Well, thank you all for having me. My colleague Ray and I will be leading you through this. I've got to say it's a little bit of a different scenario, not being able to see faces. So please excuse me if I'm looking for laugh cues and not getting it. I am used to a more dynamic setting, but we will make it work. I'm just going to assume that everyone is having a good time unless you tell me otherwise. So as Alex mentioned, I am Renee, she, her. I'm the executive director of For West Virginia's Future. We're an organization focused on building coalitions, capacity, and communications inside of West Virginia to support good work for the future of our state. And y'all are at the center of that. So very grateful to be able to connect with you today. I'm going to go ahead and share a slide deck, if that's all right, Alex, so that we can get this up and running. Okay. Here we go. So we are going to go over relatively quickly today some fundamentals around messaging. If you have questions, please hold them until the end. I will pause and then we can get some questions in through the chat box. But with the format that we have right now, it's not as conducive to sort of in the moment questions. We will also be providing you with a workbook for those of you that are on the email list. You'll be able to work through your own messaging afterwards. But if you are a note taker or someone who likes to have visual aids, I highly encourage you to grab a paper, grab a pencil now. This is your moment to prepare yourself to digest this information as we go through it. We are going to go relatively quickly, but that's because you're going to have a good chunk of time later in the session to work with your colleagues practicing these message frames, and then get some live critique, live feedback from Ray and myself so that you can be ready when you leave this training to engage your friends and neighbors on these topics. So we just heard a lot of really great examples of why this messaging is so important. We heard personal stories, we heard about the policy. Now we're going to figure out how to take all of that information and translate it into a specific formula that, if you can remember it, will help you be confident that you have an effective message every time you engage with someone around these issues or other issues. So we're going to jump right in now. What do we know? Well, I think all of us right now know fairly clearly that we are living in polarized times. The last couple of years have really made that clear. But that doesn't mean that there aren't things that we share. And when we're talking about messaging, it's really important to remember that all of us as humans and as West Virginians have so much more in common. We want so many of the same things, despite what the rhetoric may sound like. So for example, most of us want to take care of our families. We want the people in our lives to be healthy. And in West Virginia in particular, we want to be able to stay in this state. We want our kids and our grandkids to be able to live healthy, fulfilled, thriving lives here. So that's a huge bucket of issues that we have in common. The difference that we're suggesting is that we need to talk about those issues with each other, our community, and our leaders in a positive, values-based way so that we can change what's possible in our state. Okay, so we're going to talk about how to get at the heart of what we have in common using values. first, a couple of fundamentals. A lot of times when you're thinking about politics and you're thinking about who to talk to, the folks in charge will reference moderates. So moderates is a really weird term. I don't know if anyone's ever stopped to think about this, but when I think about a moderate, I imagine a person who is always right in the middle. So if you're looking at this graphic right now, where that triangle is, they're right in the middle between conservative and liberal. That's what the image in my head comes up with when I think of a moderate. But the truth of the matter is, when you start trying to put an issue over top of that frame, it really quickly falls apart, because conservative and liberal are what's called ideologies. So they're bodies of theory and thought and preference. And most people, especially what we're talking about right now, Americans, most people don't have a really firm idea of their ideology. That's because most folks are what's called low information voters. That doesn't mean they're not educated. That doesn't mean they're not well informed. That doesn't mean they don't care about their community. It just means that they probably have never heard of any of those policies that y'all talked about earlier. And so they don't have an established opinion about it before you start talking with them. Now, that might sound like something to overcome, like an issue. Oh no, these people don't know. We've got to get out there and make sure that they know. And you're right. But the trick is to think about these folks not as moderates who are always in the middle between conservative and liberal, but as persuadable. They don't have an existing base of information, so they're going to choose based on what's presented to them on a particular issue. So we know opposition folks are going to come out hard on pretty much all of the issues you've talked about, saying we can't afford it, it's not fair, what about those poor insurance companies, right? Insert thing there. Our job is to present an alternative piece of information that sounds awesome. That's a worldview that folks can feel themselves in, clearly see, and want to be a part of, so that their natural inclination as humans, when presented with two options, is to pick the middle choice, or a little bit of this, a little bit of that. They want to end up in the middle. And since we can control what they hear from our side, we can make sure that that middle is as positive as possible, or even convince them that our side, our recommendation, is the thing that's going to be best for their families. This is going to come up again and again, not so much in your formula, but when you're thinking about who you want to be talking to and why you want to be talking to them, okay? So the big takeaway here is that bottom bullet point on the right. If information can move this person, that means they're persuadable, and we want to put our best foot forward with what type of information they're being given, okay? All right, now, who should we be talking to? You'll also often hear politicos say, oh, we should only talk to, let's see, what's a good example? Recently, it's been, we got to talk to white men who make less than $50,000 a year. Those are the only people we should be talking to because they turned out bigger than anybody else, or something along those lines. Whenever you hear folks say we should only be talking to some sort of category of person, I want your ears to perk up, okay? So whenever someone says we should only talk to one type of person, notice that and take a pause, because more often than not, it is going to be impossible to narrow any individual one of us by some set of identity, right? We all have very complicated, robust senses of identity, and they're all intersecting. And the good news is our research has shown that messages that reflect that diversity and are honest about being inclusive to everyone are much more resonant. In West Virginia in particular, the polling we did last year showed that messages that were explicit about including people regardless of where they come from, the color of their skin, or what religion they believe, improved a message receptiveness, so the people that felt good about that message, by 20 points. That's a huge increase. That means folks in West Virginia want to be on the side of a message that includes the most people, that is positive, and is explicit about not discriminating based on race, based on religion, based on class or income. Okay, so that's good news for us. That's really good news. And hopefully that's empowering for you. When you feel like you have to sort of hold back, like, oh, I don't know, lean into it. Be explicit. We want to make sure West Virginia is a place for everybody. And who do we mean by everybody? We mean people who are Black, white, and brown, people with big bank accounts or no bank accounts. We mean people from the holler or the city. We don't care. We want to make sure this is a place for all of us. Okay, so lean into that. The research says that that is the way to go. Okay. All right. Now, what does the research tell us about this? So I've already gone a little bit into this, but I want to make it clear that all of these points that we're talking about can really be summarized in one idea. So if you remember nothing else, I want you to take your pencil and I want to write this down. Okay. Is this the conversation we want to be having? Okay. Now that sounds really simple. Is this the conversation we want to be having? Now, why am I bringing that up here? I'm bringing that up here because over and over again, what the research tells us is that we can use as many best practices as we want. But if we're not talking about the issue that we actually care about, the world that we actually want to believe in and live in, we're not going to be as effective. So what does that mean? That means that we don't want to spend time refuting what other people are saying. So if someone shares a fact that is not really a fact, that's really problematic, it's easy to get caught up in proving them wrong or trying to convince them. But that's not the conversation we want to be having, right? We want to be talking about a world where our families don't have to choose between getting a raise and having healthcare. That's what we want to be talking about. So whatever happens out there in the world, I encourage you to take a deep breath and just think, is this the conversation I want to be having? Okay. Now, all these points on the slide here are just reinforcement, essentially, that we don't need to compromise on presenting the world that we want to live in. We need to make it clear that it includes everyone and be explicit about why it's a good thing. Okay. Now, what do we need to avoid? A couple of things we already mentioned. But first, take a moment, pause. I want you to picture in your head a campaign that really resonated with you recently. And I say resonate specifically. So not a campaign that had a really great hashtag or went really viral, just a campaign that resonated with you personally. What I'd be willing to bet is that campaign did not start with a no, a don't, a but, or a can't. Okay? I'm willing to bet that the campaigns that you are resonating with did not start with a negative. But I know that you can think of right now campaigns that do, that say abolish, or that say no more, or don't take away, right? Now, those may be catchy and they may capture the energy of a moment. That is not, though, going to be effective at what we're talking about today, which is persuasion and moving folks towards a clear vision of the future, right? So when we're trying to bring along an entire movement of people who are ready to buy into our vision for the future, it needs to be bold, right? That goes back to, are we having the conversation we want to be having? We want to be bold, go all the way. What world do you want to live in? We want it to be positive, affirmative, right? We don't want to spend time talking about what we can't do. We want to talk about what we can do, what we could do. It needs to be future focused. And we also want it to be values based. So we're going to spend a lot more time talking about this with my colleague, Ray. But I just want to share that in West Virginia, the research we've done shows that values like authority, patriotism, care are very powerful for West Virginians, more so than most other states. So when we're thinking about what value to lead our messages with, it would be a great chance for us to use values that maybe are not as common in the progressive world, but that we know are effective in reaching West Virginians. So when I'm talking about authority, I'm talking about respect for our elders, for traditions, for rules, for leaders. When I'm talking about patriotism, this is a special term within the research that means any in-group. So it's not necessarily country. In West Virginia, it's very much state. We have patriotism for our state. We feel very bound and proud to be from West Virginia, to be in West Virginia. Some of us live in communities that we're very proud of, that we feel connection to. That's a form of patriotism as well. We can incorporate that in our messaging. And the third one I want to focus on is care. This one is probably the easiest for those of us in healthcare advocacy to work with. We're always thinking about care. In West Virginia, care oftentimes comes in the form of taking care of our neighbors, looking out for our friends and neighbors, right? Going the extra mile, volunteering. Those are forms of care that really resonate here. Okay? Yes. Okay. So as we mentioned, our messages, we want to connect our values, our identities, and our priorities when we're talking to persuadable folks in our communities. We don't want to get stuck talking about what we can't do or about what the other side is talking about. And by doing this, we can be really effective. Two more examples that I want to sort of drive home for us. The research has shown that in West Virginia, 2 frames that do this, that connect value, identity, and don't fall into partisan talking points that are very effective. Here's another spot to write stuff down if you're a note taker. So the first one is the idea that government should be doing more to make a positive difference. So this is important because there are a lot of folks in the opposition who are going to say that government should do less, right? They should spend less, they should be smaller. We found that West Virginians don't actually believe that. The majority of West Virginians know that the government can do good and should do good to make a positive difference for our friends and neighbors. So that's the first one. Government should do more to make a positive difference in our lives. The second one that really resonates with West Virginians is the idea that we want to make this a place that our children and grandchildren want to call home, can stay and want to stay. Okay, so this idea of future generations living here, really powerful, and the idea of government doing more to make a positive difference. Both of those, notice, resonate with a shared value, so something that we know connects across individuals, are positive and are forward thinking, and do not have a partisan line, right? You couldn't tell me whether that was a Republican or Democrat thing because it's neither. It's just something that resonates with us as individuals in West Virginia. All right, so how do you put this together? You're probably thinking right now, oh man, Renee, you talked super fast and I loved all of that, but gosh, how am I supposed to do that with the healthcare policy? Not to worry, my friend Ray is going to take over from here and she's going to make sure you have exactly what you need to put this into words in your own life. All right, so I'm going to turn this over to Ray. Ray, do you want me to stop sharing, let you share, or do you want me to just keep clicking through the slides for you?
I will share if that's all right with you.
All right, not a problem.
Okay. Let me know if you see it. See my screen? No?
No, not yet.
Uh-oh. Okay.
There it is.
Okay, now I have to present. Okay. Thank you, Renee. I'm actually going to stop sharing my video because my computer gets all loud and crazy when I share, so I'm going to stop video. Thank you so much, Renee, for going over the first part of the message training. As Renee said, I am Ray. I am the digital director for West Virginia's Future. And in order for our messages to stick and spread, they have to be bold, affirmative, and paint a bright image of what is possible for our future. So here is an example of an effective message that was researched and performed really well. It's values-based, positive, and overtly inclusive. And I will read it aloud for everyone, just in case you're not in front of a screen. It says, no matter where we come from or what our color, most of us work hard for our families. But today, certain politicians and their greedy lobbyists hurt everyone by handing kickbacks to the rich, defunding our schools, and threatening our seniors with cuts to Medicare and Social Security. Then they turn around and point the finger for our hard times at poor families, Black people, and new immigrants. We need to join together with people from all walks of life to fight for our future, just like we won better wages, safer workplaces, and civil rights in our past. By joining together, we can elect new leaders who work for all of us, not just the wealthy few. And as you can see in this chart here, this was really positively received by almost everyone, not just people in our base, not just the advocates, those people who volunteer with us, but also by those who are persuadables, those people who are considered moderates by lots of politicians. This was really, really well received by everyone, except for the opposition, which is actually a good thing because we want to make sure that our message is clear and our values are clear. And when it's not well received by the opposition, that's a sign that we're actually doing something right. So in a couple of slides, we're going to go over why this was so effective and what elements are needed to make a message that is effective, that sticks, and that resonates not only with people in our base, but also with people who are considered persuadables. And now, what about West Virginia? How do we translate this information, these progressive values, in West Virginia? Believe it or not, progressive change is possible in West Virginia. West Virginians do want to believe in a progressive version of the future. We have a long history of labor movements that have spanned race and class to provide working people with protections and with benefits and better pay. Although our state has been voting increasingly red, party ID isn't actually a great way to gauge support for an issue in West Virginia. We have to persuade moderates not just to vote, but to support specific issues. And moderates, or not moderates, persuadables are actually more likely to be swayed into one way or the other. Just thinking about 2016, people in West Virginia actually preferred Bernie Sanders to Trump, which tells us that despite our experience of polarization, we all want a lot of the same things. But what the dividing factor is messaging. We have to create effective messages that unify and energize not only our supporters, but also those who are in the middle, the persuadables. People in West Virginia are very receptive to progressive change, but only if it's framed in the right way. So we're going to go over the elements of an effective message and how we can craft messages that are well received by persuadables and by our base. So the first element of an effective message is shared values. So the goal is to start your message with something that everyone agrees with or that everyone can easily buy into. There are specific ideals that West Virginians value highly, like Renee said earlier, including community, family, tradition, patriotism, and care. In this first statement, the shared value should be overtly inclusive so that it's apparent that what we're saying applies to everyone. When someone reads something that they feel included in, they're more likely to continue reading. But if the first sentence is totally off base or obviously does not include them, they're not going to read the rest of your message. That's why it's extra important to be inclusive in this first statement and to also mention a positive value with easy buy-in. So when we're being overtly inclusive, that research shows that that is actually more persuasive and more well-received than having a general statement that is not inclusive. The second element of an effective message is the problem statement. So this can be a national issue, or it could just be a community or regional issue that affects many people. It should be written in plain language and framed as a matter of deliberate decisions that have been made by those in charge who could easily fix it if they chose to. So when I say written in plain language, I know it's easy for us to write with policy in mind and not with everyday life in mind. So a problem statement should really be formed as something that anyone can relate to, not something that talks about the economy or big picture things, but something more specific, like, is someone able to afford their medicine this month? Is someone able to pay the bills this month? That's the type of writing that we want to use when we're creating a problem statement. The next part is probably one of the most important pieces of the message, and that is exposing the wedge issue. A wedge issue is something that the opposition uses to be intentionally divisive and distracts people from solutions. It's generally a deflection and it doesn't add to the conversation. And oftentimes it can be coded messages that pass the blame for community or national issues onto a specific group, like marginalized communities. You want to call this out and bring attention to it. You should also explain why the opposition is doing this, and it's usually to keep money in their pockets and in the pockets of the ultra wealthy corporations and donors that are funding them. After you expose that, you go back to the shared value in an inclusive statement, and we always want to finish off with an invitation to collective action. At this point, we want to connect our unity as a community with a picture of a better future if we all work together towards a communal good. And this is the part in which we demand a government that works for the good of all of us. Now we are going to move on to an example, and this is actually a shortened version of the message I shared earlier. So number one, we lead with values to create broad points of agreement and shared goals that will resonate with nearly any audience. So no matter where we come from or what our color, most of us pitch in for each other and work hard for our families. That's an example of a shared value statement, and it's also extra inclusive, like I stated earlier. West Virginians are all about family and community, and that's why we start with something like this that everyone can buy into. Next, we move on to the problem statement. We have to be explicit in our statements about the problem and the wedge issue that's being used as a distraction by our opposition. So here it says, but today certain politicians and their greedy lobbyists hand kickbacks to the rich and drive up healthcare costs. They point the finger for hard times at poor families, Black people, and immigrants. By the end, we want to offer a restatement of a value and offer a solution to give audiences a sense of hope and a motivation to act. We don't want to just end on a negative statement. We want people to feel like there's actually the ability for a solution to happen. So we assign an action for the audience to take action steps. This creates a feeling of agency as well. We need to join together with people from all walks of life to fight for our future and future generations. By joining together, we can create laws that will help us and our neighbors. And now I'm going to read through another example really quickly, and then we will start working on our own versions of these messages. So this is without all of the elements, just an example of an effective statement. Whether we're white, Black, or brown, we all want the best for our families. Right now, though, certain politicians are putting our children's future at risk and leaving our elders in shameful conditions while they shame and blame people of color and new immigrants. We will no longer let them divide us against each other based on race, background, or identity, distracting us from what matters to our families. By joining together across communities, we can make West Virginia a place where every child, elder, and care provider has what they need to live healthy, fulfilled lives. Together, we have the power to pick politicians who will prioritize caring for our loved ones. So this is really future focused, it's really positive, it's inspirational, it's uniting, and that's a lot of the, those are all very helpful when creating a message that's effective and that will stick in the memory with someone. And this messaging framework can be used with almost any type of issue. but it's especially helpful with healthcare issues, which is what we're going to be diving into. So these are the specific issues we are talking about today, making prescription drug manufacturers return money when they overcharge, making sure every birth parent in our state has health insurance for 12 months after they give birth, and using the purchasing power of state government to provide a cheaper, better insurance plan for people who make too much money to get Medicaid, those who are on the cliff, as was stated earlier. So we're going to work through, or we're going to break into groups and work through these different messages, creating messages that are effective using the framework that we just talked about. And I'm going to pass this back over to Alex to give next steps. Are we going to do
Yes, ma'am. We are gonna do a quick poll, and Ray and Renee, thank you so much. I am so energized by this training, and I've heard it at least half a dozen times, I think, at this point. And I am really excited to do these breakout rooms. But first, just want folks to pick a healthcare issue you're most interested in. For folks that are joining us live on the Facebook, welcome to virtual trainings. I'm still trying to learn how we can do breakout rooms in this virtual day and age. So yeah, well, if you're on the Facebook, please post any questions that you have in the chat. Post the healthcare issue that you're most interested in. We're gonna do some breakout rooms and work on some messaging, applying what we've been learning. And this will be recorded. So for folks that are watching live, you can check back on the replay, right? If you just want to hop off now. So totally understand either way, but we're going to put folks into breakout rooms now based on the healthcare issue that you're most interested in. Still waiting for folks to vote, and then we will break out. Thanks. So folks will be going into the breakout room based on the issue that you are most drawn to or want to help craft a message around. So room 1 is going to be the Medicaid buy-in. So you'll want to opt into room 1 if you're interested in helping to craft that message. If you are interested in postpartum expansion, that will be room 2. And if you are interested in discussing more about the prescription drug costs and how high they are here and ways that we can mitigate that, that is room 3. All right. And the rooms are opening. And if you don't choose a room, we will just assign a room to you.
Hey there, Alex. Would it be helpful for me to reshare the deck with the instructions on it and field any questions from folks?
Yeah, do you want to just pop into each room? Is that what you're thinking?
No, I was thinking you were gonna pop to the rooms. I've got the Facebook up on my screen so I can see if folks put questions in the chat there.
Okay.
But I can do either way, whatever you want to have me do.